Well, hey guys, I'm Dr. Ben, and I want to speak to somebody out there that's got low back pain. Pain coming in maybe in the low part of your back, shooting down your legs, into your feet maybe, or maybe just like that dull, achy, low back pain. So I want to talk to you today. I'm going to show you a few things. Number one is I'm going to show you what causes low back pain. Number two is I'm going to show you what it's like to identify back pain on a patient. And then number three, I'm going to show you the fix. That's right. Miss Maddie, who works for us here in our Brentwood location, she actually said she has a bad back. I think her back is just fine. We just got to straighten it out a little bit. And I'm going to show you what that looks like. And Maddie, we're not going to cry today, right? No, it doesn't hurt. I'm just messing with you. But here's how it works. Listen. So the most important thing to understand is when you have back pain is that number one is God gave you a great body. And we understand that here at Well, that it starts with understanding that your spine is made with 24 movable vertebrae that surround and protect your spinal cord and your spinal nerves. In order for your back to function pain-free with full function, these vertebrae have to be in the correct position, and you cannot have a pinch on the nerve. Watch this. When you are, I don't know, Maddie, did you play any sports or dance?
A little bit. Ran around a lot.
Ran around a lot anyways. Probably fell down a couple of times, right? She lived life. When we beat ourselves up, what we do is we wind up shifting the vertebra in our spines, right? So we shift, I'm going to pick on the blue section here. We shift the vertebra out of position, and what that does is smashes these nerves, right? And when you smash the nerve, not only is that going to cause pain and dysfunction, but when you move your vertebra out of position, that's going to cause those muscles, ligaments, and tendons to have pain and also lock up. Right? So when you have an injury to your low back, again to recap that, we have now shifted those vertebrae out of position. Now we have stretched and torn muscles, ligaments, and tendons. Your body is going to spasm to try to keep you from doing more damage. And then the result is the fact that your vertebra now is in the wrong position and stays in the wrong position and smashes the nerve, shoots it down your leg. Do y'all get it? So now you're like, hey, Dr. Ben, that's great, but I wonder if there's any way that I could tell if I had a bone out of position. Guess what there is? It's called x-ray. And that's what we do. We shoot an x-ray of the spine. I'm going to show you a picture over here, and then I'm going to show you what it looks like on Maddie's back. So come on over with me. So this is our low back, right? Now this is just an example of L4, L5 in the sacrum and the sciatic, which is just super common. The vertebra shift out of position, and you can see that when you smash that nerve, it goes into that big bundle of nerves called your sciatic nerve that shoots down your leg. We shoot x-rays of the spine. That's what we do here because we're not guessing. I don't guess with my family's health, and I'm not going to guess with yours. We come in, we shoot a set of x-rays. If the vertebra out of position, we're here to help you. Now here's the deal. Let's say, Maddie, that you knocked that bone out of position 5 years ago, right? That bone's been in the wrong position for 5 years. If I just moved it back today, but I didn't work on the muscles, ligaments, and tendons, what's going to happen in the next 1 to 2 days? It's going to shift right back to the wrong spot, and it's going to repinch the nerve and cause all kinds of issues, right? That's what we understand. Science tells us that. So here we don't just adjust you, we're going to work on rehabbing the muscles, ligaments, and tendons to make sure that your back stays healthy. Does that sound good?
Sounds awesome.
Awesome. All right, so go face down here for me. I'm going to just show you a real quick process here. So this is the low back. Now I'm going to adjust, Maddie's okay if I adjust from here down? Yeah. So this is her thoracic spine up here. I'm actually going to feel it and adjust it. And then this is her lumbar spine. I'm going to feel it and adjust it. Now I've got a set of x-rays on Maddie. I've adjusted her several times. I just want to get permission that we're going to do it today. So as we feel down her spine, I can feel a few of these vertebrae that are out of position, specifically this one right here. And of course we've got that on our notes so I can see. So Maddie, take a deep breath in for me and blow it all the way out. Good. I'm going to push right here. Go feel a little pop. Good. Did you feel that?
Yeah.
That didn't hurt, did it?
Felt great.
Didn't hurt me at all. Deep breath in and blow it all the way out. Go push, you're going to feel a little pop. Good. Nice. That wasn't so bad, was it?
It was great.
All right, good stuff. So what we're going to do down here in the lumbar spine, remember these are the nerves right here that come out of these lumbar vertebrae, and they form that sciatic nerve and they shoot down your rear end and down to your legs. These are also the nerves that go into the female organs, intestines, digestion, or if it's a male prostate for a woman, female organs, and that's where these nerves go. So if your vertebra out of position causes all kinds of problems, and we don't like that. So let's fix it, shall we? Yeah, you got a couple big ones right there. All right, come on your side towards me. I'm going to give you a real adjustment. We're going to get it to move. Okay. So this is what we really do. So in our offices, we have several different ways that we can adjust our patients. We have adjusting tools and instruments for somebody who's maybe a little skittish about using our hands, but I much prefer adjusting with my hands. So let me show you. Come in like that. That was easy. Other side. It was cracking before I did anything. You're supposed to make it difficult. Okay? And then I come on this side. By the way, I'm not just rolling her and twisting her. Don't do this at home. But we're feeling, I already identified. Just get this hip out of position. Let's put that right back into position. Good. Face up for me. All right, come all the way up. And actually, Matt, if you would, stand up for me, march in place a little bit. How's that feel?
Feels good, loosey-goosey.
Loosey-goosey and good. That's right. So that's a simple correction process. Now, at this point, we're not done here. We're going to do some exercises to make sure that those bones stay in the right position. However, the treatment itself feels good. It doesn't hurt. We focus on making sure that when you get adjusted here at Well Health and Chiropractic, that it is a very great experience. Right? Anyway, so if you're somebody who wants to be a patient, if you saw the video, if you're dealing with back pain, and you want to get a set of x-rays to see if we can help you, please, please, please click below, grab a VIP appointment, and we will get you scheduled in to come and see us. Listen, I'm super excited that you watched this video with us. I hope you have a great day, and God bless.